So in terms of the cardiovascular surveillance, I think that the data, well, let me put it this way. I don't think that there's great amount of data to say, well, this patient needs patients undergoing this therapy needs this type of surveillance. I think it's very individualized, and at least in our center at the University of Pennsylvania, we often do surveillance in patients who received radiation to the mediastinum. So those patients are followed by a survivorship center, and they receive routine echoes. In other settings, we don't routinely do surveillance unless the patient has symptoms or issues. Even in drugs or following therapies that we know are cardiotoxic, like anthracyclines. I think the exciting area of research is how some of the novel agents and immunotherapies may affect the heart, and we have been very lucky to have a group of brilliant cardio-oncologists at our center, where looking at effects of BTK inhibitors or immunotherapies, where there could be some of the immune checkpoint inhibitors causing inflammation of the heart muscle. Again, it's very rare, but it can happen. The same with CAR-Ts. Again, we put these patients through fairly aggressive treatments, and we need to know their cardiac status before we maybe get onto the other line of therapy, like CAR-T after the initial treatment. So again, this is an evolving field that needs, I think, much more focus. But before we were able to say, like, this type of patients for sure needs this type of surveillance, I think there's a lot of work to be done.